One of the most common complaints pregnant runners share with me is urinary urgency or the need to pee while they're running. So what gives? My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist, and in this video I'm going to talk about urgency or urinary urgency with running, how to gauge if you're overdoing it or if it's time to step back. So let's first talk about why would you experience urinary urgency with running? Well, first and foremost, it could be the hormones that are circulating in your system. The hormones then could be affecting your cardiovascular system, and that affects your fight or flight or rest and digest, also known as the autonomic nervous system. Just the overall, like, are you more fight or flight? Are you more in that rest and digest? Are you more balanced? The other thing is just the changes in your body fluid can impact overall what's filtering through your kidneys and into your bladder. So where you are when you're pregnant is going to unsurprisingly be different than when you were not pregnant. The other thing is there's a major change happening in your body from a postural standpoint. So the postural changes can impact just your muscles and your joints themselves that are around your pelvis, your abdomen, that can feed into urgency directly. Or it could be these nerves that communicate with your pelvic floor muscles and or your bladder are being affected by the postural changes or the dynamic changes in your spine while you're running, which can lead to the symptoms of urgency. Let's say if it's not appropriate, you just went and you're still, then you have to go. And then when you stop running or you change something, then you don't have to go suddenly. Then the last common, but it's not the last but not least, the other common reason for urinary urgency is a pelvic floor performance problem. Oftentimes it's an endurance problem. When you are pregnant, that's an increased load or demand on your pelvic floor. Let's add top on if your running form is, then you got even more of loading happening likely going through your pelvic floor. And then let's say you're not really trained from a fast twitch standpoint between babies, you didn't rehab, then that just adds on to that muscle performance problem. So there's definitely more reasons than what I just mentioned that can lead to urinary urgency, but those three big categories are the most common that I see. So the next question would be, when is the urgency coming on? Is it immediate or is it at a certain point? If it's towards the end of a run, then I would be pretty confident that that's a fatigue problem. And then my suggestion would be, okay, where are you in your pregnancy? If you're really advanced, is this sport or is this activity serving your labor and delivery, or is there something else that we could substitute it with? The other thing would be is maybe let's cut back. Let's not get to that point where you're symptomatic. If it's happening in the beginning, that's more of a concern, and I would say at minimum I would want to do a pelvic floor exam before I say anything else. I would also want to make sure physiologically you're stable, which if you're being managed by your birth team, then that's usually not an issue. But even from a blood pressure standpoint, in the office, you're not getting your blood pressure checked when you're there, when you're exercising. So maybe it's worthwhile checking your blood pressure changes with activity. I don't do that consistently. I could. It just depends on the person and how they are presenting physiologically and if that is needed. But it's certainly something that I would do if I had any suspicions that it should be done. And it's always helpful, but sometimes it's just hard to get an accurate reading when someone's moving like that without more fancy equipment. So paying attention to, the characteristics, like be present when you're running and figure out if you change your breathing, change your technique. If that changes, maybe land softer, and then just pay attention to the timing when it's happening. If it's happening in the beginning, then further investigation is needed. If it's happening later on, maybe cut back, or maybe substitute it with a similar activity that is more, it'll serve your birth more than running would at that time. Again, my name is Jocelyn Conley. I'm a pelvic floor physical therapist, and I do specialize in female athletes and active women. Love working with runners, so if you have any questions, please comment them below. I do want to say, whether or not you are having symptoms, I recommend all women to have a pelvic floor exam, ideally before pregnancy, definitely during pregnancy, so that your goals of your birth plan are in alignment with where you are from a pelvic floor, neuromuscular, musculoskeletal standpoint. If you know anyone that would benefit from hearing this, please share, like, and don't forget to subscribe so that you are notified every time a new video drops. Thank you for listening, and I will see you next time.